the thoroughbred specifically is I owe my entire existence to the thoroughbreds. My mom, a veterinarian and a rider, my dad, a thoroughbred trainer. They met because of the thoroughbreds on the track, therefore why I owe my entire existence to the thoroughbred. I won't spell it out, you can infer. And then to go on from there, you know, I grew up on a small thoroughbred breeding farm in Maryland, like I said. So again, that was the family's, you know, that was our income base, but also our family as well was entirely built on the thoroughbred. Did pony club, rode off the track thoroughbreds then, and went on. I galloped racehorses all through high school, undergrad, vet school, a little beyond there, like up until 4 months ago. So I am probably more comfortable on the back of a horse, more specifically a thoroughbred, than I am walking across the street. I'm probably more coordinated doing that too. And so legitimately, I owe everything that I have to a thoroughbred, everything. That put me through school, galloping thoroughbreds, and they're my source of career income. They're also my source of mental escape from the work end of it. That's what I do for fun, hence the Real Rider Cup. So that I think that probably sums it up.
Thank you. I think a lot of people can relate to the attachment to the thoroughbred in this room. So Dr. Soignier, tell us a little bit about your veterinary background and your connection to thoroughbreds.
Okay, well, I'm originally from Louisiana. That's where I'm born and raised. And so my first connection with the thoroughbreds was at Louisiana Downs in Freeport. So I going to the horse races when I was finally old enough to do so. Even when I was younger, we used to go. It was a lot of fun. So that's kind of my first into the horses. And then I went to vet school and I came here for an internship. And then like Lark, I never left. I stayed here. So, you know, for me, internship was mostly based around thoroughbred reproduction. So that's kind of really why I kind of fell in love with it. And, you know, getting to see the babies and see them from the start, you know, from the little black dots on the ultrasound screen to now seeing them go out and win greater races or the Derby or, you know, all the big races. So that was, you know, really kind of kept me pulling there on that end of being able to make the baby race horses, and then the ones that go on and do other things outside of racing. And, you know, you see it all throughout different disciplines, you know, all across it, which is, I think this is a wonderful program that allows them to have those opportunities to be able to go on and have those extra careers. I think it just expands that. And like Lark, I'm honored to be here to be able to talk to you guys today.
Well, thank you guys both for joining us. I really do appreciate it. So since we have an online audience as well as an in-person audience, just so you know, if you're online, please ask questions in the Q&A in the Zoom. And my colleagues will be reviewing and relaying them. And then Shoshana over here, or Alex will be reviewing them and relaying them. And then Shoshana over here has the mic for anyone in this room so that the people who are listening can hear your questions too. So if you have a question in the live audience, please ask us to raise your hand and we'll bring over the microphone. So today the topics, let's see. All right. So today the topics we're going to hit are complementary therapies, including, here's just a list of some really common ones: acupuncture, chiropractic, massage, osteopathy, stretching, shockwave therapy, laser, vibration, other therapies like pulse help me out here, pulse electromagnetic. Thank you. It's been an early morning horse showing. Pulse electromagnetic field therapy. Thank you. And then Beamer. And I'm not going to try to say that acronym out loud right now. And the uses for these therapies are everything from orthopedic issues to GI and other internal medicine issues like airway stuff, the not quite right horse, improving overall health and performance. And there's many other things you can use them for as well. So these are kind of this is our land for today. And I'm like ahead of myself here. Okay. All right, so I'm going to pull this back up here so we have the menu of all the different types here. And to get us started, let's just take a big picture look at these therapies. So how do you each view or define complementary and alternative therapies? And what caused you to start using them in your practice?
So okay, I'm going to start with how I started using them in my practice. I backed into this. So the way this came about was acupuncture. I was actually introduced to very early in my career, like early being vet school, veterinary school at Ohio State. They actually offered an acupuncture elective, which was pretty out of the norm in that demographic. It was a very interesting class because it was taught by Dr. Scarda, who was an eccentric Irishman teaching Chinese veterinary medicine. So you can imagine it was very animated in general. So it brought alive something that I knew nothing about. So that piqued the curiosity to start. And then coming here in my internship, there were people actually in the practice that were concentrating more and more on chiropractic and acupuncture. When I moved to the racetrack practice, the clinician I worked with there, he was certified in both. I saw a real advantage to having these modalities, acupuncture and chiropractic, specifically at that time, a real advantage to having those modalities in your hip pocket when you were looking from a sports medicine perspective, or even sometimes an internal medicine perspective. It just was more of a conversation you can have with that animal in front of you that can't use its words, that's using nonverbals and patterns in their body. So I saw huge advantages to having this in your repertoire. So I very early in my career decided this was something I wanted to look into. I didn't know how much credence, because I had no background in chiropractic, even from the human end for myself. I didn't know how much credence I gave to that sector of medicine, if you would. So like with anything I don't know, I'm going to go learn about it and make my decision. So I went into it actually as somewhat of a skeptic. And the irony, I came out making it my life devotion. So go figure. So I guess you can infer from that I decided there was more to it than, and so that's how it came about. I also decided that it was something that if you didn't practice virtually daily, it's something that you definitely develop a feel and a gradation for. So that's one of the reasons the volume came in for me, is that I devoted to working on at least 3 horses a day, 6 days a week. So approximately 20 horses a week, just to get the feel and get a comfort zone with it. And then it went on from there. But and then as far as how I decide to use them, it's such an individual case thing. And we're going to get into some individual cases where it will become more clarified. And this is where it gets a little tricky for anyone in the PhD realm, doctorate realm, or any realm for that matter, is when you start bringing the word art into medicine. But there is an art to practicing any kind of medicine. There's definitely an art to the complementary therapies, meaning that the way that I paint my picture may be very different than the practitioner next to me, but it doesn't mean that either one of it. So my comfort zone is my preferred world is I address a horse from a chiropractic standpoint first, and I follow up with the acupuncture. I feel like there are a lot of what we call active acupuncture points that I can clear with a chiropractic adjustment, and it unmuddies my waters when I'm looking at a horse from an acupuncture or traditional Chinese veterinary medicine standpoint. But there's other people that may argue the other way, or if you're looking at an internal medicine thing that still might have a chiropractic basis, but we can get back around to that, then maybe you can flip flop it, but that would be.
Yeah, so just to expand on that, I agree with her. It's another tool in my toolkit. It's allowed me to, you look at, to me, I look at horses a lot differently now than what I used to. I mean, 10 years ago to the now, it's, a completely different mindset of just how I look at them I like to focus more on like the functional neurology part of it. We're looking a little deeper, as they say. We're trying to localize a level of a lesion where we may think it, not lesion as like a bad lesion, but where we think a problem may be. And this allows us to be able to determine, get a better idea of where it may be. So you kind of look at horses differently, and even at a walk or a trot. And it's kind of one of my fun games to play when I go to shows and stuff. I'm like, looking at the horses, kind of picking them apart. But that's, my brain's been trained to look at them that way. It's hard for me to sometimes enjoy them because I'm always trying to pick them apart. But I agree with her. Each case is different. I depends on which way I'm going to start, but I tend to lean more towards doing the chiropractic first. And it really kind of opens up the rest of it for you to see. And it is a feel art. It's taken some time, when I was first learning it, it takes some time to really to feel the motion in the joints and all that. And it's an art. It really is. It's a feel art. And so it takes a lot of time to do that. When you first learn how to do it, in that first 6 months to me was the most critical part, because you're like, am I really feeling something? Am I not feeling something? I'm not really sure. But, the more and more you do it, to me, I agree. It's just volume. You do a lot of them, you really can feel what normal is, or normal to you. I think everybody kind of feels a little differently, but, that's even if we're looking at a lame horse, everybody's going to have a little bit of different opinion a lot of times. And you ask 10 vets, you're going to get 10 different opinions. But ideally, it kind of helps us be able to determine more of an area to look at. And so I again, it's just case by case of what we do.
So do you have a favorite modality of these?
If I had to pick a favorite, I really like the chiropractics.
Okay.
I feel like the horses are a bit more expressive. Some are way more expressive than others. Some will give you a nice lick and chew and a good shake, and others are just like, what else you got? But you could tell, that they feel better. And to me, that's why I feel like they appreciate it a little more. So I feel like I get a little bit more love back from the chiro than the acupuncture.
Nice.
Because some of them, if they're really turned up, if those muscles really, points are really high, they do not appreciate those acupuncture needles even a little bit. And so it can be a little dicey sometimes. So usually I will do my adjustments. Like, let's just come back in a week or so. And then you'll find it be much easier to acupuncture them at that point. And, kind of turning off the nociceptor pain and kind of really like, okay, maybe they're not a bad guy. But it allows you to needle those points once there's no major C fiber pain there. Sorry, that's a little neurology talk. I apologize.
It's super interesting. Thank you. And what about you, Dr. Carroll? Do you have a favorite? I think I know what it is, but.
Okay, what do you think it? No, I do lean here. So there is some immediate gratification behind the chiropractic that does appeal to a practitioner in the moment in front of. So that's part of it. And I tend to have that. And here's very interesting, not to totally go down the rabbit hole of the 5 elements in Chinese medicine, but I have a very fire personality, which means I don't accept needles on my body very well at all. In fact, when I last got my acupuncture, I knew I needed it. I had been adjusted. I had a sciatic pain that I couldn't fully control with chiropractic adjustments on myself. So I knew I needed to go to an acupuncturist to continue to resolve the issue with other PT and stuff like that. And so I remember getting the needles in, and I'm on this treatment table, and it has the paper on it, and the practitioner walks out and she can hear me wrestling in there. And she comes in and she's like, is there a problem? And no, how long are these in? And she said 20 minutes. And I'm like, it's been 2 minutes. And so and especially with the thoroughbreds, we encounter a lot of fire personalities. So it's not that and then the other flip side is you might encounter a lot of earth personalities too, that are just really chill and docile and just eat up I had an assistant. She loved her acupuncture. She would run to her own personal human acupuncturist and would fall asleep on the table. And I'm the person next door wrestling with it. And it's been 2 minutes. And we encounter the same thing out there. So and because a lot of our thoroughbreds tend towards the wrestling paper on then it creates a separate kind of challenge. And I can work with that very well from the chiropractic. It's a little bit more of a project from the acupuncture. So that's what might create a favorite.
That's cool. Thank you. I think I know which one I think I know which one my thoroughbred is.
Yeah.
Probably a fire, definitely. I mean, you know this.
Yeah, fire equals happy,
Yes.
equals energetic,
Yes.
equals friendly, and his name's Happy.
Well, he loves when you come to visit him. So I'm going to transition into some questions about orthopedic issues. Let's look at some of these uses here. I've got a few questions that I pulled up that were common questions, and please feel free to raise your hand or come through on the chat if you have anything related you'd like to ask. So here's the first question. My retired racehorse eventer is notoriously tight in his back. Saddle fit is good, and we take a lot of time to warm up. What complementary or alternative therapy could he benefit from? Which one of you would you like to go? Heath, Dr. Soignier?
I'll go. Well, then for me, always the question is whenever I have horses that are sore in their back is why, right? So let's try to figure out why is he sore, and majority, I see a lot of horses that, saddle fit's fine, that all feels good, but they're really tender in their backs is, I see a lot of hock issues with those guys. If they're hock sore, they tend to compensate to the lower back, and those backs usually are on fire. So I always, I'll try to treat what we got a problem here, but a lot of times I always tell people I can treat it, but it's probably going to come back if he's really sore in his hock. So, let's focus on what our main issue is here. Let's figure out why is it his lower back. So, we'll get into, at that point, trying to do a lameness exam or even x-ray in his hock or stifles, or try to figure out why is he sore there. Always with these therapies too, I like that you have stretching on there, because I'd like to incorporate and teach my clients how to stretch their horses after we make these adjustments again, because you want them to continue to have that active motion that they're going to have. So in this case, for me, that's be one thing I would look at. The orthopedics play in, okay, does he have hock arthritis? That's needs to be addressed, because if I can come in and adjust him and acupuncture his back. I can make him feel better, but I'm not going to fix him. So we got to figure out why. And that goes back to my other comment of localizing level of lesion. So let's figure out where he hurts, because they're going to tell you, yeah, I hurt here, but why do you hurt there? Does it actually come from somewhere else? These guys are the kings and queens of compensation, right? And so they can move it all around their body, and it can take a little bit to figure it out. So we got to figure out what is our primary cause. So in a horse like that, that would be my main thing. Let's figure out why.
Thank you. Do you have anything to add, Dr. Carroll?
One thing I'll add that I think is applicable specifically to this demographic that we're seeing outside this window here. And it goes along the same thing that he's saying about finding a primary cause. So a very, very, very common, and I expect our big raging crowd here to have some feedback here too, is we get these off the track thoroughbreds, and a lot of us will struggle with their feet when they come off the track. Thin soles, big thing that is a hump to get over, if you would. The transition from being shod a certain way for racing versus being shod and the upkeep for being turned out. This is a perfect example. We are in central Kentucky with 6 years of no rain, and then we've got these off the track thoroughbreds that are having to accommodate for a lot of turnout, if not full-time turnout, that they're not used to, a whole different level of foot care in general. These guys get pretty primped and painted multiple times a day at the track. And I know very conscientious horse owners that aren't, that the program's different, very conscientious, but very different. So we are seeing a lot of neck pain, back pain that's secondary to that. So I bring up that point just because I have no doubt that there are people in our audience, on Zoom and otherwise, that have encountered this. And so until we can get that scenario under control, it's job security for us, which is not what we're after
it's not what we're
necessarily.
after,
And, it's just one of those things that I impress upon owners, and trainers that this is something we're addressing in conjunction.
You know, and that goes back to us, we're always looking at the horse as a whole, right? We're not looking at just one specific area. We want to look at everything, all of that comes into play, especially with these guys, when they're walking around on their middle fingers. So, and we're asking them to do a lot of things that they shouldn't, that they really weren't made to do. So we're asking them to do those things. So we have to be mindful of all of it. So I think she brings up a great point.
Yeah. And the thing is like, and we do encounter horses with primary back pain, and that's part of our investigation, is deciding what is feeding that. And it may be,
fine.
yeah, it could be there.
Anything.
And it can be surface. What surface are they working on, because it may be totally different. Maybe they came from a synthetic racing surface and now they're transitioning to a deep sand ring that they're working in. So that very much, so there's so many aspects that you can glean nuggets from that history and your physical exam, that again, you look at this horse and it's a puzzle. So those are the things that we practice putting together.
Yeah.
Great, thank you. Those are great perspectives. All right, any questions in the room before I move on? Any online? No? Okay, everyone's just enjoying listening to you. All right, so I've got another one. Maybe some of you guys can relate. My off-track thoroughbred pulled back in the cross ties, breaking them. I wonder if that has stressed or otherwise negatively impacted his neck or the rest of his spine. Is chiropractic something that we would want to apply here?
Okay, so for this one, the time, it just totally depends on the time frame in your physical exam. So, what did that incident look like? Are we tied with a nylon halter? Do we have not a breakaway thing? Do we have did it create abrasion? Did not? What's his head? And usually for us as practitioners, as we're walking up to them, talking, we start calculating that movement on that horse as we're entering the area. Like from the moment I get out of the car and I'm having a conversation with you, I have an eye on your horse and what is happening with their posture and their interaction, because I can already tell how they're interacting in that environment, what some of the things we may be dealing with. So yes, we do something called motion palpation. We're literally hands on every joint, seeing what that range of motion looks like. And we're putting it in perspective to all the other horses we've adjusted or motion palpated leading up to that too. So that can give us a gradation, some diagnostics with our hands, so to say. So it can give us perspective there, but also just their mannerisms can tell you a whole lot. So, and we also are assessing their pain response or their discomfort there. So they may be at a point that there's enough soft tissue trauma associated with that incident that they are not a good chiropractic candidate at that site. We may be adjusting in distal portions like low neck or other regions to help support that. And we may have to do it, I say, is the onion peel. We might have to do this, in stages, so that we may have to address the soft tissue issues another direction. That would be a case for laser, maybe if there's a specific area, that may be a case for acupuncture. And it may be that the incident or our physical exam gives us enough alarm that it may require diagnostics before we decide to add in work, chiropractic, other things, certain stretching. So it just depends on the extent of the incident. For the most part, it's incidental, and they have just like, I woke up on my neck wrong kind of attitude, or, you had a sudden stop in the car and you have that more whiplash kind of look. But even if you went to your human chiropractor, maybe that you go on the rolling bed today and you get lasered today, and then you come back at the end of the week and you get adjusted. So that's a very common situation that we encounter.
Yeah, I'll agree with that. Again, it depends on, did it happen today? Did it happen 2 months ago? because it's going to make to me, it makes a big difference because you get there and he's got road rash. And I mean, I'm not going to adjust that horse that day. We're going to treat their soft tissue injuries. So I agree with her 100% on that.
All right, thank you. What was that? We've got a positive environment up here. All right, we have any orthopedic questions from the audience, whether virtual or in person? It's your chance to pick the brains of these great veterinarians. No? Okay, we're all ears still. Nothing online. Okay. So let's talk about some GI issues, perhaps. So here's a question about some GI stuff. My mare can get gassy, especially with changes of weather. Could she benefit from acupuncture?
Yes, I mean, I mean, there's, we do have specific points and that can help GI movement, GI motility. I know where I learned that cure core from acupuncture, and it's in Colorado in conjunction with CSU. Dr. Mindy Story, she told me she does a lot of her colics. She'll acupuncture those guys, and does it help? Yes. Is it going to hurt anything? No. Do I acupuncture every colic? Probably not. It just kind of, again, it's a case by case basis. But if I feel like one's extremely gassy, we get a lot of gas back on our tube, and that's a horse I probably would, trying to help get that gut moving a little bit to get that out of there, right? So I think it can definitely helps in gut motility. Like, you got anything you want to add?
I would say, and this is the direction you're also going, but I'll use the word anxiety.
Okay.
So a lot of horses that this scenario might come up for tend to be horses that are high anxiety, high energy, high anxiety, which is something that acupuncture sometimes again, it's that fiery personality that don't take the needles very well, but there's many different ways that you can stimulate acupuncture points without needle specific. So so you can do pressure. Also, you can do point laser treatments on those. So there's a lot of times where horses are absolutely not accepting of the needles, but you can stimulate those acupuncture points with a laser, and that makes it's your next best thing, is the happy medium. So I think if you can circle around again, we've got those symptoms of the gas, the ulcers, the colic. And from a Chinese medicine perspective, there's a very stimulating book out there called The Web That Has No Weaver, and it's a little bit intense, but it's stimulating is being a little sarcastic, but the giant principle of it, you can either trust me or you can use it as nighttime reading, but the principle of it is that you've got Eastern and Western medicine, and everybody wants to treat them as two totally separate entities, but they're really not. They're addressing the same issues from two different angles. So Western medicine tends to have a lot of focus on mitigating your symptoms. So you have heart disease, but you have high blood pressure. Maybe you've got diabetes factoring in, you've got glaucoma factoring in. So we're gonna address each one of these tiers. Eastern medicine says, okay, all of those are symptoms from one root. And so when you are addressing it from an Eastern medicine standpoint, you go back to that root. So maybe what you're describing, that scenario here, the root comes from a place of anxiety. So if you use the acupuncture to treat the anxiety, you can get that.
I love that, because if you think about the people who are inventing those class 4 lasers in Europe and, improving them in Europe or wherever they're making them, they don't necessarily create it to be used on acupuncture points, but it's useful for that. So, oh, there is now? Oh, excellent. That's super cool. I think class 4 lasers are the coolest. So maybe we can talk a little bit more about those later. So going into some more medicine topics, respiratory problems. This is one that I haven't heard as much information about with complementary and alternative therapies, but we did mention it in an article on the horse. And so I wanted to see what your perspectives were on it.
I mean, to be quite honest with you, I haven't had any cases that I've really treated with it. I mean, other than upper airway, with laryngeal hyperplasia, that's more of where I've used it in. But I probably should be using it more in even some respiratory cases, right? So again, goes back to what Dr. Lark said from the beginning. We're always trying to learn and do things and learn new stuff and do new things. So, if she's got some way she's treating them, just learn about it.
No, so we're probably seeing a skewed demographic too. I'm not to speak for you, but the demographic that I'm seeing are a lot of young sport horses, and even before then, because I'm seeing a lot of thoroughbreds from birth through weanlings to the sale, through yearlings to the sale, and then through breaking and then to the track. So we see a lot more upper airway issues that we're combating there. Most people aren't calling me when they've got a foal with pneumonia. Like, I'm not their first call. So that's not the demographic. That's not what's in front of me. Now, if they were trying everything in conventional medicine and we needed to add another tool to the toolkit, I could find tools to go that direction, and have in very limited instances. But I do wonder if it's something that's underutilized. And, I hear one criticism in the human realm and even in our veterinary realm, they say chiropractors think they can cure everything, right? With a chiropractic adjustment. And I think it's because, I think that's poor communication on multiple levels from both ends. What I like to bring attention to, and you mentioned functional neurology, like what I like to bring attention to is that the chiropractic adjustment is way less, the magic in it is not that range of motion you get necessarily. The magic is in the neurology behind it. So every one of those segments in the spine, you have spinal nerves exiting from. Those spinal nerves go all over. Maybe they go to the surface, maybe they involve the joint, maybe they go internally, and you're looking at lungs, you're looking at urinary tract, you're looking at. So I like to bring this to people's attention, because if you have an issue along the spine and there's impingement on these spinal nerves that are going to specific areas, surface or otherwise, we actually can have a huge impact on them. And so I know this isn't a respiratory case, but I think it's worth bringing up alongside this. Is I had an MD, a doctor, she had, her sport horse, and he was stretching out and acting like he wanted to urinate. Didn't ever seem uncomfortable. It wasn't really colicky. And, she did all the things to check. They check for bean. She went to a $2,000 workup at the clinic, did, urinalysis. They did ultrasound. I cannot find blood work. Can't find it because she's MD. Let's do this. Let's do, and I was at her farm looking at another horse, and she just brought it up, and she goes, "You don't think there's anything that could be done here?" And so I like to call this the Hail Mary case. Heck yeah. Yeah, no. But I said, here's the thing, is I'm looking at this horse, I'm motion palpating. He's got fixations in his lumbar region, his low back region. I said, incidentally, this region that he's showing some issues is the area where you would have exiting spinal nerves that involve the urinary tract, stimulating the urinary tract. So I said, let's see. So we adjusted that horse, and sure enough, no instances of parking out for over 6 weeks. Recheck him, so I say that now, can we cure all those cases? Heck no. Like, don't divorce your conventional medicine by any means. But in that case, she had done a full workup, and I have one more incident to share. It's a human end on my end, because hopefully people will find this comical as I did. One day I'm jumping into the back of my Jeep to grab something out of the trunk area, and I used the bumper to do it and jump up and very unsmartly did not calculate roof to top of head and I slammed the top of my head on the roof and I just crunched. I could just feel the crunch to my neck, and I don't have the healthiest lower neck anyway. And I'm thinking, oh, that I'm going to pay for that later. So with a sore neck. Well, fast forward to dinner that night, I'm sitting at the dinner table and I'm going, whoa, I didn't even drink. And I'm having rushes of tachycardia. My heart rate is going, I'm going, what is happening here? And so anyway, I couldn't, long story short, it was significant enough over a couple of days. I called my general, my own doctor, went to, no, can't find anything. Even she referred me to a cardiologist. No, can't find anything. Happened to have a chiropractic appointment at the end of the week. And so the cardiologist actually mentioned to me, he goes, weird thing. He says, we can't send you home with a heart monitor. He goes, this is a weird thing. He says, I've heard of people get adjusted and this is, taking care of this issue. So here, after spending all this time and money and everything, and this is the realm I work in, I go to the chiropractor and he goes, yeah, your lower neck's, there's a ganglion. So there's a whole group of nerves that if you compress them, it will alter your heart rate. And so I, sure enough, after adjustment, had no issue with it. But it's just curious. Again, it's not that we're curing cancer with this. We're not curing everything. But in those odd moments where you're not sure what you're looking at and you've looked at all the obvious biggies, I think it's worth having an open mind what else we have in our toolbox, being chiropractic, acupuncture, and otherwise.
Yeah, I was just gonna say that's the fun of having that extra tool, right? And again, another way to think out of the box a little bit. We went to school, it's all, we learned all the Western medicine. This is all, they give you tits and tats a little bit through school, but to me, it was another way to look at cases, right? And that was the whole reason I wanted to get into it. It was just, I felt like we needed it within our practice and to offer that. But for me, I was really interested in it because I was like, here's a different way to look at things. Let's go explore it. Now, I will say after the first weekend of all that neurology, I was like, I'm not sure if I'm fit to do this. But I ended up going back and finishing out and fell in love with it and loved it. But again, it's even those little instances or they've spent all this else. It's just one other way to look at it. And will we make a difference? Will we not? I don't know, but it's worth exploring, so having that available for our clients, I think is wonderful.
Thank you. And that real world example from your own life, because you can talk about what you're experiencing. The horses kind of have to give clues, of course. So, all right. So that was a great example of the not doing right kind of horse, the horse with the bladder issue. Dr. Soignier, can you give an example of a time where a horse just wasn't doing quite right and you prescribed or you used the complementary therapy to figure it out and maybe treated it with it?
Yeah, I had a horse, I wouldn't say it wasn't too long ago, but he presented for a forelimb lameness. They're like, we blocked him out. We can't figure it out. We, think it's high in his shoulder. So, I'm going over this horse and, again, we're just kind of going through our thing. So everybody has their own little deal, just feeling every joint, listening to everything that they're saying, watching this horse walk. And I'm like, man, I really don't think it's in his shoulder. So, but his brachiocephalicus muscle is it's the only muscle in the body that crosses two joints. I think I didn't know, that's pretty cool little tidbit anatomy fact that I love to tell. But the innervation for that muscle, so it crosses over the shoulder and attaches at the elbow. The innervation for that muscle is accessory nerve that comes underneath the TMJ. So whenever I motioned that horse's TMJ, it was completely restricted. And even trying to open in his mouth, he had issues. And I adjusted his TMJ and magically goes away because now he's got innervation to that muscle and it's not restricted there, so he can move. So that was a really fun case because I was like, one of those immediate ones, right? So it's like, wow, it just makes a huge difference. So, but again, had I not had that knowledge to go and even think to look there, right, to even know that those nerves come out of the brain right there, and that's what, the what's the word, innervation for that muscle is, it's not down the spine, it's actually coming out underneath the TMJ. So, but that goes back to making an adjustment to where those nerve endings are and having that response. Again, it's not so much the TMJ joint itself that was hurting, it's the impingement of that nerve underneath there, not allowing the innervation to go to that muscle. So it goes back to the case you talked about earlier. It's the same thing with her when her personal, it's impinging there, it's messing up a lot of other systems. So it's a lot of, everything's, we're just motioning bones. It's everything. It's the tendons, it's the muscles. We're feeling all of it because they all come into play. They're all innervated by the same nervous system. So that's what we're affecting when we're doing chiropractic. We're affecting the nervous system and stimulating the nervous system to move and act like it should, hopefully, right? And that's the plan. But we're not just affecting, just the bones or the joints. It's actually everything.
And I know that in my own life, I've been seeing a chiropractor for many, many years, and I've actually been seeing a holistic physical therapist also.
Yeah.
And I can just go in there and say, my right arm's been falling asleep when I've been sleeping on my, and I think it's my cervical, and they'll check it. And they're like, yeah, it's that. So you almost learn to know like which nerves are impinged by the things that you're feeling.
Well, that was my first, I never been adjusted before until I was, my first class actually I went to, and there was a DC, so Dr. Chiropractor was taking the course as well and sitting behind me. And that morning I woke up, I couldn't hardly turn my neck. I've been having pain in my hands when I would drive. I'd fall asleep, my hands would fall asleep, and I've been having that issue for a long time. And so like after the first hour of class, we get the first break, he taps me on the shoulder and he goes, "I can help you." And I said, "What do you mean?" He goes, "You can't turn your head." And he goes, "Are you having some numbing in your hands?" I said, "Yes." And he's like, "Tell you what, I'll come by later and I will adjust you." I'm like, "Man, I don't know. I've never had that done to myself. I'm not sure if I even believe in this yet, right? This is the first day, right? I've always heard about it, and I was always a skeptic, and I feel like a lot of people are until they can actually see the benefit from it. And when you do that, offer that benefit, it really opens your eyes to it. And I'd never been able to turn my head as well as I could after he adjusted me. That was, it was one of those immediate things for me. I was like, "Oh my God, I can turn my head." So now I'll go once a month, but I probably should go more than that. But it was a big eye opener, right? If I can offer this to a horse that's in the kind of pain I'm into, and they can't tell me that, I have to find it, it'd be pretty cool.
That's cool. You're about to say something?
Yeah, so I was just gonna say, like,
Okay.
on those lines, I was like, I never blame someone when it's hard for them to wrap their head around the concept of chiropractor acupuncture. I always say, people don't know what they don't know. And so it can be intimidating sometimes. My mom's a veterinarian and she calls me Dr. Voodoo because she likes things that you cut on or you give a pill to, or you do, so. But Dr. Voodoo is not so bad if she's got a horse entered to run in a Pennsylvania bred stake at, then all of a sudden Dr. Voodoo sounds like a good idea to go over the horse. Yeah, absolutely. So the point is like, here's perfect examples. Many of us can share personal experiences that have opened our eyes to these therapies. And so, and I tell people, and one argument is, well, I don't, and it may be for themselves or their horses. Well, I don't want a chiropractic adjustment because then they're addicted to it. You have to go all the time. And I go, it's not like an addiction, like this kind of addiction. It's there's relief out there and you don't want to not have the relief if it comes up. So it's more knowledge is power, and you can go forward with it rather than it being creating a dependency. You don't create a dependency, you create an awareness.
Like this is how I'm.
And I know something that you do with, and probably most veterinary chiropractors do this, but you pay attention to the patterns and you let me know about them. And then over time, you tell me, okay, well, this is the pattern he's had before. Now he's moving into this pattern. How interesting is that? And, he had changed into a different field of horses and he plays a little harder now, that kind of thing. Right. So it's been interesting to see. And sometimes you say 4 weeks and sometimes you say 8 weeks. And anyhow, so I love that you guys are so observant of your patients and what they're showing you and telling you. So any more questions? I'm looking, nobody has questions. Here we are, a quiet learning group. Yes. Okay, so so maybe a horse doesn't have a problem, but you want to offer it the best care, right? We are a group of horse owners who really want our horses to be happy, healthy, and comfortable. That's why we're here in this room or on the Zoom. If we're not set on correcting a problem, but are wanting to incorporate a therapy to bring our horses comfort, what would you recommend?
I always tell people, hey, I want you to come look at my horse. I'm like, okay, is there a problem? I'm like, no, I just want you to go over him. And to me, a lot, you'll be amazed at the things that you can find in some of those horses. Disciplines always play, a role in how, certain horses, when they do a certain thing, you can, for a career, they tend to have the same, it's like us. We hurt a lot because we've tried to move these big horses around, whereas somebody who just does reproduction, just mares, it's a whole different muscle movement. So when these horses have different disciplines, they're asking different muscles to be used. And so I always tell people it's great to go over them, because even if you're not having an issue, because I feel like even a lot of this can be preventative. If we have horses that, have again, a really tight brachiocephalic muscle, right? And it's not innervating correctly, and that horse travels wrong and it doesn't use the muscles in its leg like it's supposed to. I think that can lead to tendon injuries because those muscles aren't strong and acting like they're supposed to. They're attached to, muscle attached to tendon that attaches to bone. So, but we can affect those things and allow things to link them. So if you got one that's really tight and you ask him to go jump 4 foot and he lands on that, that sets him, he's predisposed to an injury and in that area. So if we can allow those things to move like they're supposed to and be loose and actually have them do their careers like there's, like they're supposed to, like we should, I should probably go more often. But I feel like we can help prevent a lot of injuries as well. So I think it's worth going over them at least once to see if you have anything. And then, I always tell, a lot of times if I get a horse through something, or if we're not having like a pattern deal where I need to see you on a schedule, it's okay. You ride them every day. When something's not right. My tech is a great example. She can she's not right. I'm like, well, okay, was she lame? She's like, no, but there's something's not right. And we'll go over and we'll find something. And it may be minor, maybe small, but you have to have that connection. And the thoroughbreds, especially because they will tell you, I feel like they have no problems telling you something is wrong with it. Whereas in some other breeds, it's like, you have a heart rate of 100, you should be like in pain right now and you're just staring at me eating carrots. So whereas in the thoroughbreds, which we're main focus on today, those guys will tell you when they hurt, and you just have to be listening to them. I always tell people, you gotta listen to the horse, and they're like, well, if he's not talking, like, he's telling you, you just gotta learn how to listen. And that comes part of it. That's a connection that we all have with the horses, right? And I think that's what makes horses special. But again, I see no harm in going over what has never been seen. Let's just go over and see what we find. We might find nothing. You might just say, carry on with life and call me when you need me. Or be like, hey, we found some issues that hopefully we can head off before the major problems.
Thank you. Do you have anything to add to that one?
Just like probably the most loaded question we probably get is, does my horse need adjusted? And I'm like, here's the thing. It all becomes a cost benefit ratio. Like, I can find something to adjust on every animal you lay hands on, like that. And same with people, so it becomes a cost benefit ratio. Maybe it's it's a case of economics, is it between, your winter hay or your, chiropractic schedule, there's a balance. But for the most part, I think it is all of it is best used as a preventative. You get a baseline now, we see trends, we keep track of trends that can tell you a lot. All right, have you changed shoe types, training surfaces, disciplines, so we can help negotiate some of those transitions. I also see it, especially when we see it in the growing horses and horses that may be combating injury rehab, or horses that are and have been cleared and no overt signs of lameness and everything. Like you said, there's no issue. And I always implore people, when they get a horse first off the track, to have an adjustment there. I say there's certain patterns that come with certain jobs, exactly what you're describing. As if you're a secretary over desk, your pattern is different than than another type of anything that you do repetitively will create a pattern in the body. So for instance, our horses that are on the track that are doing counterclockwise fast work, I will tell you 9 out of 10 or 99 out of 100 horses that I'm adjusting there have a left sacral apex because they're doing counterclockwise fast work. So these horses that are coming off the track, it is very good to try to clear some of those patterns that they may have gotten asymmetrically, or know that they are coming to you symmetrically before you start to pile on their next endeavor. So it's a very good starting point for these guys here, specifically this transition or any transition that comes up. So I think that's been a big, and just like you said, you know, people are like, I don't understand why you like working on thoroughbreds. They're so high. I go, because it's not a secret. Like, you know, some of my draft breeds or my big, you know, like I have to stare at them longingly to get like an eye flicker when a leg is falling off. And my thoroughbreds, like this hair is going this way and this hair is going this way, but they'll leap from here to there because the hair's in the wrong direction. So, but at least it's not a secret. And you have to get a comfort zone with working with those different demographics too, to be able to, I say, you know, some thoroughbreds, I make them prove it to me 3 times. Like I go check an area, I go somewhere else, I come back, check it, I go somewhere else, I come back. Is it for real, or did the wind blow from the east in the moment that I touched that point? And so, you know, you get that comfort zone when you're going over them, so you can see what's legitimately there, and kind of piece your whole picture together. So.
Yeah, I'll add that ponies are also in that group. Because they think that you're trying to murder them most of the time. And then once they realize what you're doing, they're like, oh, that's right, you're that guy. Okay, you're cool, you can hang out. And so, yeah, I add those guys into it as well.
Are you saying ponies have opinions?
Ponies are very opinionated and they have their people. And a lot of times I'm not their people. I'm just a big scary guy. So, but yeah, but you know, like she says, again, they're going to build whatever NFL players, you know, those guys are going to have completely different set of, you know, restrictions and injuries and whatnot compared to me walking around. And they're also going to require a higher incidence of being seen or treated, whereas I don't, because I'm not asked to do those things. So I always tell people too, where if you got a show horse that's going every weekend, or, you know, is going for, you know, 2 months straight, he's probably going to need a lot more help than the horse that's, you know, getting rid of once a week and going to a couple shows a year. And, you know, as far as doing it more or whatever is needed. So I always try to, again, cost benefit is, you know, if your horse is going to go show in 6 months, is he okay? Do we need to go over him today or not? Because again, I can help him out and get him going where you can train up to that. But, you know, I don't feel like we need to see him every 2 weeks or every 3 weeks or whatever to get you to that point, because you're going to do one show. If we can manage him, you know, see me once or twice, then great. Whereas, you know, you got a lot of those horses that are going a lot. They're going to need it. To me, that I feel like they need it a little bit more because they're just, again, that's their job of hardcore and they're going every weekend. But again, you know, you see that, and those horses are going, you know, on those show circuits and stuff. I feel like they do a lot, you know, they do a lot more than just like my horse at home does. So she likes it, but she doesn't get it as much because, I mean, she eats grass and makes me smile. So.
So I'm curious about, so between adjustments or between acupuncture sessions or whatever, what are some things that you would recommend? Stretching, let's talk about some of those maintenance type things, some of those things you can help your horse with mobilization.
Okay.
Yeah, so stretching and exercise is very, very important. And there's probably people smarter than me that have even more extensive exercises and stretching. Most people are very familiar with the carrot stretching, but there's certain techniques, and sometimes it is as simple as bringing them around to their barrel, but you can target with more specific types of carrot stretches, if you would, to different parts of the neck. So that's always important. The other thing is what I like to bring up too is exercises, like proprioceptive exercises. And then people are, what does that mean? So, and it can be tuning in their like balance, which helps with core. And a lot of people are familiar in doing it and don't even know they're doing it because we're talking about ground poles, we're talking about cavalettis. I like to incorporate backing exercises in because that creates a stretch and a proprioceptive kind of challenge as well. So there's lots of things we can do there. Now we're seeing more advanced balancing exercises or methods too, that I've helped people coordinate. There's actually products on the market, but like in the human realm, they have balance pads for people that we use for creating stability in small intrinsic muscles. So those are things that you can put back into the hands or the power of the owners. Most of them are labor intensive. I try to streamline it for people. I say like, specific, just say we're working on neck mobilization and stretching. So I say, put it into the routine with something you do naturally daily with them, because generally you're better about staying with it then. So I say, you're going to pick your horse's feet every day, or every time you bring them up to ride. So at that moment, this is when you're going to incorporate this stretch, so doing things like that can make a big difference. We've had horses that have had neurologic deficits or, come back from something like EPM or a neck injury. And I say, okay, let's put these three poles on the ground between the barn and their field. So they're going to be asked to go over it every day they go out and every day they come in. So you're at least getting that much in. And when we get through 3 and we're not clobbering them, let's add in another one and a fifth one, so like you can do subtle things. It's amazing. Even more subtle than that, like moving them from different substrates, meaning they go from the blacktop to the grass to the sand. That challenges their core and their proprioception too. So maybe going to your field over here, you've got a blacktop region, a sandy region, and you actually do like a serpentine through that to go there. So there's a lot that they can do subtly that is actually good for every horse, but particularly if we're addressing some of those underlying issues. I have a lot of clients that are incorporating some of their own PEMF, the pulse electromagnetic field therapy, or they have a professional that comes in and does it. A handful of clients will also incorporate vibration or TheraPlate or an Equivibe or something to that effect, which I think can be very beneficial as well. I have been able to work on handfuls of horses that I know pretty intimately before that some of those modalities came in versus after. And so I've been able to see some trends there. So all of that are valuable things that we can kick back and put it in the hands of the owners.
Yeah, I'm all about target stretching. Again, it depends on what we find, but building a strong core is, if you don't have a core, then you don't really have much, like me. So I don't have really a strong core, but I feel like in the horses, that's where all their strength comes from. It comes from the core. And you can't make them go out there and do sit-ups, but we can make them do a lot of the things that Dr. Carroll had talked about, that just helps, even just in everyday movement, to help build your core. I mean, you're working your core every day, whether you're sitting up, standing up, sitting down. The question is, can we just target it a little bit more to add in a little bit extra to help them build that? Because without a core, you don't really have much. So, I always tell my clients, it's focus on strengthening our core, because that's what's going to build our top line and everything else. It all comes from the core.
Indeed, it does. And I know I've taken some of Dr. Carroll's advice, and I've gotten some of those balance pads and have taught my horse to stand up on them. And it's interesting to see his muscles moving in just a very slight way as he uses his core to balance on those. And I'm teaching him how to do the hind legs too, which is a little more difficult to teach, but it's amazing. They love to do it too. At least that's been my experience. I mean, I've taught my horse how to do standing crunches, and I did that by using positive reinforcement as he was backing up against a wall where he had to curl his butt, and then he lifts his belly and lifts his lower back. And it's just been kind of fun to watch him become stronger with these exercises, with some of your guidance. So thank you. So I was just curious, any questions? Anybody want to ask anything? All right. Okay, so one thing I've found really interesting about the complementary and alternative therapies over my career at the horse has been just how much more research has been coming out about them. Reflecting on, I don't know, past decade and a half, are there any things that you have learned from reading the journals and have said, okay, well, I'm going to use this therapy more because now I know it does this or that. I know lasers, for instance, there's more and more research coming out. We just ran an article in the horse a few months ago on class 4 lasers and the research coming out about them. So yeah, you guys are the experts. Tell us what you've learned from the research studies.
Laser's the big one. That's the one that's really, they're coming out with a lot of things now. And I really like the laser because you can target areas. The treatments aren't really, doesn't take a whole lot to do, but you can do a lot in that little bit of time. And so I really like the laser. I probably should use it more than what I do. But again, it always comes back to always trying to figure out, learn more, do more. And then, okay, is this applicable for me in my practice? And how can I incorporate it to be able to help? So we're always looking for anything else that we can help give our patients, and not so much an edge, but some way of getting them relief or being able to help them in some way. So, but yeah, laser is the big one.
And so it is so exciting to see that research coming in, and some criticism will probably we've encountered, especially more specifically from the chiropractic acupuncture.
Yeah.
They've gotten way better with what we're able to measure and go. Right. With the chiropractic, we'll get some criticism from a hardcore peer reviewed, need to see it black and white to believe it. Where's the research? Where's the research? There's always complications with those studies controlling variables, making sure that what they're testing is the medicine and the science behind chiropractic medicine and not the adjuster.
Correct.
So you're not, they're not really, it's not like they're pulling 50 different chiropractors and seeing what results they get. Usually those studies are based off one practitioner. So then you're really just testing the results from that practitioner and not the science as a whole. So, we look forward to the day that we're able to control more variables and maybe get some of those studies out in circulation. That's for my retirement.
Right. Well, and again, though, it's hard. Okay. How many horses today had, a C3 body right?
Mm-hmm.
Okay. Did that horse move? Did I adjust that one as well as I did the last one? So I agree with you. There's so many different variables to come and play with that. And how do we put all that information together? Mm-hmm. Again, you and I are proof that we know that that science is there and science works. But getting it on paper is very hard.
So, other common questions you're out on your truck and you're visiting with your clients. What are some things that you get asked on a frequent basis about the work that you do?
No.
I asked my tech, she remembers everything. We got, what's a common one we get?
Oh yeah.
Yeah, that's a good one. Yeah. Can I have my horse adjusted the day before competition? I do not like to do that. Sometimes, like me, when I go, I can be a little sore the next day. And I don't feel like that's fair to them to do that. I usually ask, if I adjust a horse that day, they get that day off, and then tomorrow I want them to do light work and then, gradually build that. Personally, I like to see them at least a week out from a show, kind of minimum, because if there's going to be some other issues that may come up, I don't want you to have to go to a show and him big sore and then rail everything and you wasted your money because, because of what we've done. So, again, I like to see them out. I like to see them out in front of the shows a while. Usually after you've done a lot of your prep work, want to see them, make sure they're going great and feeling good. And if there's issues, we can attack them then versus waiting and doing it the day before, because I'm gonna tell you not to go and then you'd be mad at me because I told you not to go after you spent your show money. So, but again, my job is to advocate for the horse, and so that's what we're gonna do. And so, yeah, no, don't call me the day before. I'm not coming in.
How about you, Dr. Carroll?
And so, and I think that's a really good generalization, and I would agree with that. I think there are, when you do it as much as we do it, and you have a certain rapport with the individuals and the horses, I think there are instances where I would see them closer to if I'm targeting a specific issue. So, but that's a lead up. If I've never adjusted that horse before, then no, it's not inside 48 hours. But if I know that horse and I know that horse's patterns and there's something specific we're addressing, then that's different because, and I get it a lot on the racetrack. They go, they'll have a list of horses and then this horse is on the list and, oh, I'm going to breeze them tomorrow. Is that okay? And I go, it's not that it's not okay. For the most part, especially, a lot of those are based off preventative rather than I'm adjusting an issue per se. So it's part of the preventative realm, but what you were alluding to where they get the next day off and then have a light day the day after that and go from there, that conversation is not because we want them to have 2 days off so they feel extra good later so you can tell us how wonderful we are. It has more to do with there's science behind that. There's actually neurology behind that. When you have an impingement on the nerve, the science does tell us that it takes 48 to 72 hours for that nerve to fire back optimally. So what that means is that it changes how the muscle around those segments are operating. And so it's at that 48 to 72 hours that you're going to have optimizing of the muscle and soft tissue around those regions, which is going to hold your adjustment better. You're going to see better mechanics at that stage. So that's that magic. I like to explain that to people so that they understand, usually you have better client compliance than when they understand that science. And I say, if you absolutely have to go to that jump schooling tomorrow and you have to do that, that's fine. Just understand that we may have to come back and adjust that horse sooner because they didn't hold that adjustment as well. And I call that job security on you because my recommendation would be 2 to 3 days. So I think there's, and we probably do the same thing if you are in that situation, we're doing more target adjustments so that they are safely, competing or going to that lesson the next day. Cause I understand, there are time restraints and things like that. So we're doing more target adjusting than we are getting the whole thing in. So it does behoove everyone involved to plan ahead for that series. And we can work around it. Just understand the trade-off that comes with working around it. And we just have to come back and do it next week again.
Correct.
Okay, so we like to buy our horses things like blankets with magnets and the ceramic infused textiles. And what was that? Halloween halters. Yes. Nice. So I'm curious, let's say we have a nice budget and we want to go buy our horse things to make them feel better in a stall when you guys can't be at our farm. What would you buy? What are the things you use on your own horses that are do you use the ceramic? Is that what it's called? The ceramic? Is that what the back on tracks are? Yes.
So my horse is not a good example. Again, she has to tote my kids around and make me smile and eat grass. So she does get adjusted, but she gets nothing fancy. She's spoiled enough as it is. But for me, I always tell people, it's kind of always like when I go to Lowe's or Walmart, I end up buying those little trinkets at the cash register, right? They're more for me than they are actually for anybody else. And a lot of times I think there are some great products out there I think horses enjoy. Again, they got minds just like us, they a lot of them are intriguing, especially the thoroughbreds, you know, they're always into something. So giving them something to, you know, also stimulate their mind, I think always helps. It helps with that anxiety. It helps with those things as well. So, and, you know, if they're happy, and I'm all about any of the back on track products. I like those things. I'm not a huge blanketer, so don't shoot me for that. I'm not a big blanket guy. If the horse is blankets, so yeah, so if the horse is clipped, yes, it needs a blanket. If it doesn't, they've survived thousands of years without them. I think they'll be just fine, just like my horse, unless it's like blizzarding, and my wife makes me go put it on her. But other than that, you know, I'm not a huge guy on that. But so sorry, that's just my own personal opinion. Please don't shoot me for that. But yeah, so I mean, again, there's so many different things out there. I don't really have any that I recommend. I have a lot of clients that tell me things, and I'm like, to me, it's not going to hurt, right? If the horse is happy and you're happy with it, I think and especially if you've got all the money in the world to buy whatever you need. I mean, spoil them. A lot of times the horses are extra kids, right? So, and I spoil my kids, so I spoil my horse a little bit too. So I expect you guys to do the same.
Anything to add, Dr. Carroll?
You know, so most of the things that we see out there, I am sure there are very valuable products out there. Probably the more valuable ones, maybe we don't even know about. There's just some companies that have been really, really good with marketing too. And like with anything, my grandmother always said the truth is somewhere in between. And that has served me very well in life. And it probably is the same with all the products out there too. The truth is somewhere in between. I think there are some very good products. We've had discussion, for instance, on the ceramic technology between and I have seen personally on my horses and other things where there has been benefits to it. I always caution people with those technologies, read the fine print and the fine directions there. That specifically, it has to do with an interaction with some membranes in the muscle bellies there. But what that means is those products are meant to go on for smaller time frames at first, and you actually pull those products completely off after a certain amount of usage, and then you reintroduce them, because we know from a physiology background that anything in the body that you stimulate, there's a counter system that down regulates it and brings it down. So I tell people, when you're using those blankets, when you're using those leg products and things, that they are very useful until you go and leave them on for 12 hours a day, 365 days a year. Then they just become very expensive blankets and things. So it really behooves you to understand the technology, understand the physiology and how they're looking to target what their claims are, and make sure that you're using it appropriately according to that science, if you would, that underline, because otherwise you're defeating the purpose.
Thank you. Okay, guys, any questions from the audience? Oh, we have one over here. Could you repeat the question, Soignier? Oh, well, it's okay.
What advice would you have for recent vet school grads who are considering adding complementary therapies into their practice?
So, the simple thing would be to go get the training. And find mentorship and get experience, because it takes a lot of. That's a simple thing. The hard thing is looking at the nuts and bolts of that. It is not inexpensive time and money by any means. Because it's postgraduate work it's postgraduate certification that you are looking to obtain. So you have to factor it. That really, the inexpensive part is the cost of the program. The expensive part is the travel back and forth, the time away from work, And then, you're taking on, it's a commitment. It is a large commitment. So my advice would be find mentorship and opportunities to immerse yourself in these different avenues, and then make a plan financially and otherwise to be able to get the certification programs are very, very important for lots of reasons. And then you have to think about the continuing education on the backside of it, because it is equally as important. Like I'm a member of the International Veterinary Chiropractic Association, and I have learned a ton by my international travel and what I've been in techniques that I've been introduced to overseas that, sharing ideas globally is real eye-opening. So that is a very valuable part of being able to incorporate it in with great effect to the practice. And then kind of what I explained before was then once you have an understanding and you do the courses, then make a commitment to do, even if you have to beg, borrow, and steal horses to practice it, make a commitment to doing it at a certain level that is daily or every other day or whatever works for you, so that you're able to get the feedback you need to incorporate it effectively.
Yeah, I think you're completely right on that. I think it is a commitment. It's a commitment to learning it and then doing it. And it takes a fair amount of horses before you really even are comfortable with it. I can just even remember our first time. I'm like, I have no idea what I'm feeling here. And then one day it just clicks. But it goes back to, I don't think you're wrong going directly in and doing those right out of school, but also keep in mind that you're going to have to find the clientele for it. But again, the mentorship, because again, it's an experience of learning how to do all of that. So, make sure that you're really into it and interested in it. And then before you kind of make that commitment, because it really is a commitment. It's not one thing you can just show up and do 1 day or 2 days a week. It's an everyday thing. I mean, we look at horses every day, and but to me, I think that helps make you a better practitioner because you're doing it every day. And for me, during the breeding season, it's like half my day, but I'm seeing it every day because I just use it on some of those different cases or different, the brood mirrors and the foals and things of that nature. So I'm still doing it. It's a little bit different demographic than it is for me this time of the year. But so again, it's just doing it every day and making that commitment to it. So mentorship is key.
And I do think there's a lot of value in having a basis in your general practice before you go out there and devote it to the complementary therapies, because it does help you give perspective in what you can truly, your job is to advocate for that horse when you're in front of it. So part of my job when I'm going over that horse is identifying what I can help and then what you need to recommend. So a lot of my recommendations will include follow-up with their general practitioner or different kinds of specialists or different kinds of imaging or diagnostics. And I wouldn't have enough experience to be able, and that's what makes us stand out as veterinary chiropractors, acupuncturists, et cetera, from say someone who's layman, and that's a whole nother can of worms, but you have enough medical background to be able to safely advise different pathways that will truly get the horse seen appropriately and treated appropriately, because it may not be something that is a chiropractic candidate or an acupuncture candidate. It may be a whole nother level of medicine.
Correct. And I think that's the other thing too, is we're not going to be able to fix all of them. And some of them just aren't candidates, what we can do, depending upon if there's an injury or anything like that. It may just be out of our realm. I've had plenty of instances where I'm like, I can't help you today, but I know somebody that can. Mm-hmm. But that takes experience of just seeing horses for whatever things we've seen over the years, and knowing what I can and can't treat and or can and can't help. but finding the right diagnostic tool, again, it all circles back to localizing the level of lesion. We got to figure out why. So if it's, if he's got a bone sticking out of the side of his leg, I can't help you with that with a chiropractic adjustment. You need a surgeon. So, but so it's identifying those things. And I think the experience that you gain in your general practice will help you in that regard and going forward. So, but I feel like having that is important.
Thank you. So I want to, because I know sometimes when we thank and we applaud, everybody walks away. I just want to remind everybody to stay for the door prizes here in the next few moments. Okay, so everyone stick around for the door prizes. I am so grateful to you two for coming to join us this morning. Please join me. Oh, do you have a question? Okay.
What do you recommend to the horse owner in looking for somebody that's qualified to do that? Because where I live, there is a human chiropractor that just went out on a limb and now he adjusts horses. And so how do you separate?
So that's a great question. And the way that so there are two certifying bodies that we come up under, and it's the American Veterinary Chiropractic Association or the International Veterinary Chiropractic Association. Both, so it's IVCA and AVCA. They both hold us accountable to the certification programs of many hours, and we have to be you either have to be a human chiropractor or a veterinarian to be able to qualify to even take these courses. So that off the bat. Then that we have to have, there's certification testing that you have to go through. And then they hold you to CE hours, continuing education hours, every 3 years. So anyone who they list on their websites, they keep pretty accurate, I think so. Yeah. So, yeah. So, I always advise people look on those websites for names of practitioners in your area. So IVCA, AVCA, it's American Veterinary Chiropractic Association, International Veterinary Chiropractic Association. And that separates out groups greatly right there. You're welcome.
You haven't really touched on shockwave therapy. Wanted to get your take on it. From what I understand, like magnet wave, the jury's still out. What do you feel like is, in your experience, how effective is the shockwave?
So for me, shockwave is, I use it as a treatment modality. I wouldn't say, so I like it for certain things, and that's just me in my own practice. I like it for sesamoiditis. I like it for tendon injuries. But that's about as much as I personally use it in my practice. And now it's got a range of modalities that it's used for, to treat different things. I think it's a great one. I think it works, but I mean, I think it has its spots where you would use it. I don't think it can use it just to, my horse has got a really sore back, I'm just going to shockwave it and carry on. To me, you're not addressing what the real problem is at that point. Do I think it can help some of those horses though? Yes. But again, I'm more worried about finding out why. And so is it a good treatment? Yes, it can help treat things. And I know a lot of people use them for different deals. And like I say, just me in my own personal practice, I only have a handful of things that I pull it out for personally. So I really don't have a great opinion on it as far as treating a whole lot of different things. That's just because I like to use it on just certain things.
It comes with a price tag. And sometimes that's a limiting factor because you have to commit to a certain level of treatments. Most of the time you're committing to a minimum of 3 treatments up to 5+. They're costly treatments. So it's a commitment financially and otherwise. So a lot of times it's not something I incorporate in my practice because that's something I refer back to the practitioner for. And we do, but it's something we work up to sometimes. Most cases we're able to manage. Back pain tends to be a threshold. If there's primary back pain, it tends to be a threshold issue. There's multiple factors that are contributing to it. You know, that's why we talk about saddle fit. That's why we talk about feet. That's why we talk about surfaces. That's why we talk about conformation. We talk, you know, and so most of the time we can mitigate and bring down that threshold with all these other things that we've described. Sometimes we can't. Sometimes there is a structural issue there that you have to bring out the bigger guns for. I would consider this a bigger gun. So it is very good for a select group. But there's a lot of factors in deciding that. And sometimes it's a financial decision as well. And sometimes it's a time thing too. Sometimes we can address this over time, but we don't have time. So we have to speed up the process, and maybe this is part of speeding up the process. So that would be another consideration.
All right, thank you. Well, speaking of time, we're out of it. So please join me in thanking Dr. Soignier and Dr. Carroll for their amazing advice today and answering those questions. And we thank Rood and Riddle Equine Hospital for their sponsorship of this seminar. And it's time for a door prize.
Our first door prize is a $100 gift card to the tack shop of Lexington. And the lucky winner is Stacy. Can't pronounce the last name. That looks about right.
DEBU. Yeah. Okay, good. Right over here.
And for everybody else who's here, we've got some bottles of horse shampoo, I believe, that there's enough for everybody.
All right.
They're right up there on the bar.
So help yourself to some shampoo. And in about 10 minutes, we'll be starting our next seminar. Okay, thank you.